Time now 9:13. Medical treatments are advancing every day. Dan Wells sat down with Dr. James Maher to learn about new cancer treatment methods.
19 for a Cure is sponsored by TriHealth.
Ready to go? Yep, ready. All right, first off, good morning, Dr. Maher. Talk to us about personalized care as far as cancer treatment goes.
So cancer treatments used to be sort of what we call a shotgun approach as we addressed cancer care. We were trying to get those fastest growing cells and trying to slow that down and potentially even stop their growth and even cure patients. However, that approach has many really difficult side effects, also affects sort of normal cellular function and how your body works. So over time, we've developed these approaches called targeted or precision medicine. We look at what is the thing that's preventing the cancer from growing, or rather encouraging it to grow in a certain manner. So about 20 some years ago, there was an initial drug that was created for a specific mutation for a thing called chronic myelogenous leukemia. This drug is called Gleevec, and it specifically addressed one little change that caused that cancer. And as time's gone on since then, we've really developed many, many different targeted agents, pills and infusions that just target what's causing the cancer to grow. So we're really personalizing to that individual patient in that situation for their cancer.
Well, and I would imagine too, the benefit to that is you're getting that at TriHealth, number one. Number two, these patients are walking away with hopefully success.
Yeah, many of them very, very successful. So we had cancer patients that, for instance, with lung cancer, when it's very advanced, stage 4, and many of those patients would live 6 months to a year. Some of the new immunotherapy and targeted agents, they're living for years. And I can think of 4 or 5 of my patients that no longer would have been with us that are now with us 4 or 5 years later because of these newer treatments.
With all of that said, I think a lot of people ask about the future of treatment, of cancer medications, to your point, and you're seeing a bright light.
Oh, very much so. For me, it used to be that you would have an episode with these patients, some of them that had advanced disease, and then you were talking about palliative care potentially going into hospice. Many of these patients now, it's actually become a chronic disease. Some of them are on chronic treatments that I see them quite often. I can think of many patients that I've seen for 8, 9 years on these treatments. They're doing fine. They go home or they see their neighbor, and the neighbor goes, "Oh, you're being treated for cancer?" And I think everybody's thinking in an old manner. TV shows that show this, it's very dramatic to show people throwing up and losing their hair, but that's fairly rare now, depending on the cancer. So,
which is so good to hear. Last, point, I think it's really important to get out there is, even though we're in this coronavirus pandemic right now, people should still seek medical care and screenings and treatment if they need it.
No, definitely. So in this setting, we continue to care for all those patients that had been diagnosed. We obviously upped our procedures on how we monitor and watch the people. They're a little more susceptible in this situation. However, there's many people that did put off that care, and they're just coming back now. We're running at a little bit higher than our 100%, what we would consider our normal level. And that's to accommodate all those people. We have in place all safety measures to keep them protected, to keep their family members protected, and they really need to come back and be seen. Deferring screening procedures like colonoscopies and your mammograms, and really seeing your primary care doctor for something that's unusual, you should go see them and be evaluated so that your care can, really move forward.
It's valuable information. Dr. Maher, thank you so much for your time.
Okay, appreciate it. Thank you.